Hi, my name is Lucas Treese, and today I'll be talking about how exercise decreases cognitive declines in older adults with dementia. So, for this project, my mentor was Dr. Veronica Ria. My major is biology, and today's date is November 15th, 2020. So, to begin this process, the research question and thesis were created. So, the research question that was studied was how does exercise decrease cognitive declines in older adults with dementia? And the thesis that was created was people that participate in increased levels of exercise will experience less cognitive declines than their counterparts who don't. So, the first part of the paper was the introduction. This was a overview of what dementia is, the types of dementia, and the cognitive domains that dementia must affect. So, dementia is a disease that affects people of all races, genders, ages, and areas. It doesn't matter who you are, where you're at, what you look like, dementia can affect you. Dementia is described as an impairment of intellectual functions that develop over time and affects one or more of someone's cognitive domains. The cognitive domains that are found in humans are complex attention, executive function, learning and memory, language, perceptual motor function, and social cognition. The domains are listed in the Diagnostic and Statistical Manual of Mental Disorders, and in order to be diagnosed with dementia, a person must have an impairment in at least one of these domains. There are five types of dementia, and they include Alzheimer's disease, dementia with Lewy bodies, vascular dementia, frontotemporal dementia, and even mixed dementia. So now I'm going to discuss the cognitive domains, what they are, and what part of the brain controls them. So complex attention, which is the person's ability to retain information, is controlled by the parietal lobe of the brain. Executive function, which is the ability to control other cognitive abilities and behaviors, is controlled by the prefrontal region of the frontal lobe. Learning and memory relates to the ability of humans to learn new information and retain that information. This domain is controlled by the hippocampus and other structures in the temporal lobe. The domain of language refers to the ability to understand the language and to formulate complex sentences. This domain is controlled by the frontotemporal and parietal lobes of the brain. Each is actually responsible for a different activity. Perceptual motor function is the ability of a person to connect their sensory skills to their motor skills. This is important so a person can perform many movements and interact with their environment confidently. This action is controlled by both the cerebellum and the frontal lobe. The frontal lobe is actually responsible for the movement being required, however, the cerebellum is responsible for making sure that movement is exactly what it needs to be. Social cognition is the last domain enlisted in the regards to dementia, and this refers to how people see, store, and relay information based on interactions with other people in other situations. This process is actually controlled by the amygdala. So, Alzheimer's disease is the most common form of dementia and occurs in actually 1 out of every 14 people over the age of 65. There are less known types of dementia, and they include dementia with Lewy bodies, vascular dementia, and frontotemporal dementia. Alzheimer's disease is the most common, like previously stated, and one of the reasons for that is that it is tested and diagnosed for at a greater rate. However, the other types are not studied with the same measures. Frontotemporal dementia and dementia with Lewy bodies have very distinct pathologies. However, the symptoms diagnosed instead of the scans, which means that doctors will look about what symptoms these patients are showing and how they're acting instead of looking at scans of the brain and just the body in general. So dementia is actually seen in older adults more and is seen in over 30% of people over the age of 80 years of age. So next we go to the body of the paper, which is actually the bulk of the paper. So dementia is treated with many different pharmacological and non-pharmacological treatments, yet there's no official cure for it. There are pharmacological treatments such as acetylcholinesterase inhibitors, memetine, antipsychotic medications, and atypical antipsychotic agents. The use of non-pharmacological treatments such as exercise have been proven to be advantageous in hospital units and elderly care homes. So exercise increases people's gait, stability, and strength and will lessen the risk of falls for people with dementia. One of the biggest things for people with dementia is the ability to live an independent life. In order to do this, exercise may be used to promote independence, activity, and stability. So a study shows that even the slightest amount of exercise that people participate in can delay the onset of dementia. This study was completed using a prospective cohort study that follows people over a long period of time. Dementia will cause people to lose control of their bodies and their muscles, and a disease that is similar to muscle effect being muscle is muscular dystrophy. Muscles that aren't used or aren't used correctly will atrophy, which means they will die, or they will lose their connection and lose their firing mobility. So exercise is proven to prevent or fix the atrophied muscles, and the use of exercise has also been studied in the treatment of frontotemporal dementia. So the blood flow to the brain allows the brain to recover from most issues that can arise. And however, in all medical treatments, some people simply cannot be treated with exercise. One study shows that moderate to high intensity exercises doesn't slow down cognitive declines, but it actually does improve physical fitness. So early life activities can delay or prevent the chance of being diagnosed with dementia. So some of the things that can delay dementia are playing sports, working out, just being healthy. One of the things that can speed up or initiate the onset of dementia is actually being unhealthy throughout someone's life. So since exercise has a positive effect on the risk of diabetes, it can be applied that exercise affects dementia in a positive way as well. Hypertension has also been highly associated with the onset of vascular dementia, and post-stroke dementia is one of the biggest issues that is related to strokes. Many people suffer from post-stroke dementia due to the lack of blood flow to the brain during a stroke. So with diabetes and hypertension, exercise can improve those issues, and then that will also delay the onset of dementia. So exercising in early life, such as childhood or early adulthood, can actually delay the onset of dementia due to proper blood flow being there for most of a person's life. Dementia is affected positively by exercise, and many doctors recommend exercise as a treatment for dementia. Exercise must be used in all settings that deal with dementia, such as nursing homes, elderly care facilities, and even hospitals. So people who are sedentary, which means they don't do a lot of physical activity and they're mostly just sitting most of their life, have a higher risk of comorbidities such as diabetes, hypertension, and even have a higher risk for dementia. So humans with dementia must focus on their activities of daily living. These activities are all affected by the onset of dementia, and people need to control these things if they want to have a good quality of life. People that have dementia that stay in hospitals do see a decrease in activities of daily living scores, but exercise has shown to help these scores actually improve. Exercise has helped patients with dementia. However, finding people to provide the exercise has been a little bit challenging. So exercise providers tend to not have the experience, the knowledge, or the supplies that they need to work with these populations. There are also things that can actually delay dementia as well. One of these things is education. The more brain activity somebody uses in their early life, the less chance they have of developing dementia. One of the easiest things for people to do throughout their life is to simply just exercise. And exercise as well as education and keeping a brain stimulated will delay the onset and even prevent dementia. So it was found that nursing homes that implement exercise programs to patients with dementia have shown a better activities of daily living score, and there is a borderline significant correlation between dementia and exercise, and adults that live in elderly care homes must exercise. Nursing homes deal with many different types of people, and one of the things that they have to do is adjust their treatments based on the person. So with dementia, no two cases are similar because there's so many symptoms and so many different issues that go along with dementia. Nursing homes, elderly care facilities, and even hospitals must change their plans based on the person and the symptoms that are being shown. And any type of exercise will help people with dementia and actually just in general people. So exercise has definitely been proven as one of the best uses that isn't medical. Dementia affects a person's intellectual abilities and even physical abilities. However, it will also affect the people that will take care of them. So a caregiver will see these people all day, every day, and it'll take a toll on their body and their mental state. So the exercise classes will actually both help the person affected by dementia. However, it will also allow the caregivers to get their mind off of it and allow them to talk to other caregivers so they can best help the person that they're caring for. Overall, dementia is one of the most pressing issues on society and will continue to be as the society ages. Even though there's no current cure for dementia, scientists and doctors have come up with a plan on how to treat it and how to make people's lives with it just a little bit easier. Living a sedentary lifestyle, like said before, has proven to cause many issues such as diabetes, hypertension, and among many others, and these things are correlated with dementia. If someone is diagnosed with dementia, then this doesn't mean that their life is going to be a struggle. They may struggle with certain things. However, with the right plan of care, they can live an easier life. So after completing this research, there are just a few things that could potentially be researched more. One thing is just how exercise classes impact the caregivers of people with dementia and how their state is also affected. Another thing that could be further researched is the exact type of exercise that positively impacts dementia, whether it be cardio, stretching, or yoga, or all three. Besides these things, this research has been extensively completed and not many questions arise from it. And then these last three slides are just my references. I hope you enjoyed this presentation and I thank you for listening in.